Hey folks, I'm Dr. Rene Piedra. I want to go over with you something really important in our quest to provide you with healthy teeth and gums for a lifetime. We can do everything that we do here. We can do it well. We can do what the periodontist or the periodontal therapist does really well, but without your cooperation at home, we're not going to succeed in acquiring or achieving healthy teeth and gums for a lifetime. That's our primary goal. The one thing that I want to bring home to you is the importance of this one particular thing that will help us achieve this, and that is flossing. Okay, you can brush several times a day. You can get in here every 4 to 6 months for a cleaning, but if you don't floss, we're not going to achieve what we want to achieve. The reason being that, supposing that you do brush well before going to bed, there is accumulation of food underneath the gum line. What happens is that you go to sleep, that food rots, where I'm referring to the food underneath the gum line, and that rotting food is just, it's plaque, it's just a lot of bacteria. That rotting food with the minerals in your saliva becomes hard, and it becomes as hard as a rock. And that hard plaque is called, as many of you know, tartar or calculus. But this particular calculus, it's as hard as a rock. It's like having a pebble in your shoe. It causes irritation, it causes inflammation, but you don't feel it on your gums. So your gums may bleed on occasion when you brush, they may bleed on occasion when you floss. The worst thing that this calculus does is that it makes you lose bone around your teeth. And once that bone loss starts, you cannot cure it. So you end up losing bone little by little. And by the way, this is something that you don't feel, which in my opinion is the worst part of periodontal disease. Because if you did feel it, you'd do something about it. Unfortunately, you don't feel it. So you end up losing bone around your teeth little by little, and eventually your teeth become loose and you lose them. Before then, before you end up losing them, well, you know, that leads to removable partial dentures, implants, other costly procedures, and you really do want to keep your pearly whites